What is young adult hip?
So young adult hip is a subspecialty of orthopaedics. It focuses on patients who have hip pain or groin pain, really between adolescence, so teenage age group, up until probably around the age of mid-50s or late 50s, focusing on all aspects of the groin and the hip.
And what are the symptoms of young adult hip?
So the symptoms are groin pain, often, and maybe even anterior thigh pain, related to often activity or sitting or positional. So patients might be driving and they get anterior or groin pain, or certain sports, and they'll suffer the pain. It comes on while they're doing it, and then they'll suffer with it afterwards, and that's very typical.
So what should a GP do if a patient presents to them with these symptoms?
So first of all, of course, the GP needs to assess the patient. And the key thing is in the history would be groin pain, not really hip pain, because most patients will point to sort of their side when it's hip pain. So what we're really interested in is groin pain, that's pointing at the hip joint. So that would be the history. And then on examination, it's pain in the hip joint or in the groin when they internally rotate. So they flex their hip and they turn their knee in, and that would reproduce their symptoms. And it's also that history and examination, and it's not settled after 3 months of conservative measures. So that yes, they can send them to a physiotherapist for assessment, but really if it's been going on for more than 3 months, they really need to come and get at least screened by the young adult hip service.
If a patient is referred to you, how would you treat them?
So there are a variety of treatments depending on what the pathology is, the diagnosis we make, and that can be anything from conservative and advice through to simple injections, physiotherapy, which can be done locally for the patient, or if they need specialist physiotherapy, they can come here. Then we can move into forms of surgery, which would include hip arthroscopy, which is keyhole surgery of the hip, which I and another consultant colleague specialise in. And then it goes on to bigger surgery in terms of pelvic osteotomy or femoral osteotomy, which involves cutting the bone and resetting it, realignment surgery. And then beyond that is joint replacement surgery, either hip resurfacing or total hip replacement, of which we have a specialist experience here, and particularly the young patients. We frequently do hip replacements in people under the age of 30 or even 20, which is obviously done quite rarely elsewhere. And so we offer the whole remit of hip surgery for all complaints for patients in that age group.
What difference does it make for you to diagnose this condition early?
It makes a massive difference. The problem is that we need to see these people early, because the longer that it's left undiagnosed and treated repeatedly without coming to a definitive diagnosis and definitive treatment, the damage is occurring. And unfortunately, so many of the patients that I end up seeing who are in their 30s or 40s, the damage has already been done, in which case the only option for those patients is a hip replacement or hip resurfacing when that is appropriate. And it's extremely frustrating to have so many patients who've languished for many years, when I know that if I'd seen them in the first year or so of their symptoms, that we could have delayed or at least or reduced the likelihood of them needing a joint replacement at that young age. So 3 months of conservative management, and if it hasn't worked, they need to come and see us sooner rather than later.